This is my health care reform plan. My plan has the ability to see that all Americans are covered. You cannot be denied coverage and would get rid of Medicare and Medicaid. Now, before I get into my plan, I want to mention two things. Any government plan would not be fair competition, especially since any government insurance plan would most likely use taxpayer dollars to support the plan. Now, if what the president says is true and the government's plan would not use any taxpayer dollars and would stand on its own, then I say have at it. But I find it hard to believe that the same government that gave us Social Security, Medicare, Medicaid, and the post office can give us better health care coverage than any private insurance company. But if they want to try, go ahead. But like I said, it must stand on its own, no taxpayer support. The president also wants to make health insurance mandatory. His reasoning was because we are required to carry auto insurance. Well, this is only partially true. We are only required to carry liability insurance. We are not required to carry collision, etc. If you have borrowed money to buy the car, then the lender may require full coverage. Liability insurance is there to cover the other guy in case of an accident. Where, may I ask, is the other guy when you get sick? I have also heard the president say that if you don't have health insurance and you end up in the hospital, the taxpayer will get stuck with the bill. Well, my question is, why? You gambled and lost. The bill is yours to pay. Now, if you have income sufficient enough to be able to afford health insurance, then you should buy it. But as an adult, if you would rather spend your money someplace else, then you are liable, you and you alone are liable for any medical bills that may find you. If you don't have full coverage on your automobile and have an accident, who's responsible for the repairs? Why, it's you, of course. Now, here's my plan, and it has three parts. First is frivolous lawsuit reform. Just about every sane individual west of Washington, D.C. realizes that this must be done. It could save us billions on healthcare costs. Second is insurance regulations. Get rid of some, create some new ones. Now, these regulations should be designed to foster competition and protect the insured. Open it up so insurance companies can sell policies across state lines. Mandate that insurance companies must accept pre-existing conditions. The only time an insurance company can reject someone with a pre-existing condition is if that company has already met a percentage quota for applicants with pre-existing conditions. Insurance companies cannot drop you, unless, of course, you don't pay your premium. Now, also allow insurance companies to be creative with their plans. Let them create plans that the public wants. And there should be no regulations on what they can charge for these plans. The free enterprise system will regulate price. If they want to sell a policy that covers abortion, as long as it's legal, and or fertility treatments, then let them. The price of one particular policy from one particular company has to be the same for all policyholders in a particular lifestyle group. Now, these lifestyle groups would include things like, are you a smoker, are you a drinker, your body fat percent, are you an abuser of drugs, skydiver, etc. Everyone would pay the same for that particular policy. So you as an individual can get the same price on the same policy from the same company as a large corporation would get for their employees. So basically, anything that you have control over could affect your premium. And that's the only thing that can affect your premium. Now, we can debate whether or not age should be one of those factors. I tend to say no. But if your premium goes up, then it must go up for everyone in your same group. All overweight smokers will pay the same premium for the same plan from the same company. If you want a cheaper policy, then stop smoking or lose weight. Now, the government can create a seal of approval for certain plans, but we as Americans are not required to buy them. The only people that must buy health insurance are individuals that are on any type of government assistance. Because chances are, if they end up in the hospital, we, the taxpayers, will probably have to pay for the bill. So I say we may as well subsidize their premiums on a plan from a private insurance company that has this seal of approval from the government. And if you are on any type of government assistance, I better not see you walking out of a Best Buy carrying a 50-inch HD TV. But that's another question, or that's another topic for later discussion. Now, the third piece of my plan would be to gradually phase out Medicare. As the insurance companies compete and prices come down, the government can start subsidizing private insurance for those over 65. Well, actually, why are we doing that anyways? No matter what your age is, if you have a large enough income, then you can buy your own insurance. Remember, the insurance price must be the same for everyone regardless of age. Unless, of course, you have paid into Medicare with payroll deductions, then you should be able to get that money back. So here's my plan in a nutshell. Frivolous lawsuit reform. Let insurance companies sell whatever plan they want at whatever price they want, as long as they charge the same for everyone in your lifestyle group. The only thing that can make your premium more or less than your neighbor are things that you have control over, like smoking, drinking, body fat percent, etc. If you can afford it, purchasing of healthcare insurance is your choice. If you gamble and lose, then you pay. If your income is below a certain amount, no matter what your age, then the government can subsidize your premium. Also, if you receive any government assistance, then you must buy a private policy dictated by the government. Well, that's my plan. What do you think?